Osteoporosis is a disease of the bones in which the bones of the person gets weak. It's usually a natural process, like in females after 50 and in the males after 60, your bone starts getting weaker and weaker. But in some people, due to multiple reasons or maybe some reasons, it happens very rapidly and their bones become very weak and their chances of bone problems like fractures increases uh, as compared to normal people. If you're taking steroids for any problem and there are other metabolic reasons like diabetes mellitus and some inflammatory reason like if you have arthritis, rheumatoid arthritis, and thyroid disorders. These are the most probably common reasons. Apart from them, there are some rare reasons which we usually don't consider. People with osteoporosis usually present with uh, back pain. Mostly they present with back pain, and in the elderly they come with fractures. Usually, people fall at home only, and with some trivial injury like just by falling, slipping on the floor, they get fractures. When they fall, they get fractured in their wrist joints and sometimes in the hip joint. It's a dull type of pain. It's mostly present all the time. It's not that severe kind of pain. It's not like you are doing your activities, but you always feel uncomfortable. So you sometimes you use painkillers, but mostly you keep on managing. And when things go for long, like for months, then the patient usually comes to the hospital. In osteoporosis, you need to avoid a few things like you have to be extra careful at home. When you are walking, you have to take care that you don't slip because mostly in osteoporosis the chances of fractures are more. So mostly people come to us while taking bath. They slip on the wet floor, and they used to have get fractures. So in the elderly people, we recommend to be careful while taking bath and while using stairs, especially. And also, if there are some loose things in your house, like if you have some loose wires on the floor or some carpets, then you should be extra careful. It's a treatable disease. There are different ways to diagnose it. There are different criteria. Like there is a FRAX score, which is usually a international score in which when the patient comes to us, we consider few things like some clinical things, like the age of the patient, the uh, disease for which he has come, and there are some risk factors like smoking, diabetes, and apart from that, there are other things like X-rays. And finally, there is a one investigation we call it DEXA scan, in which we measure the density of the bones, and according to the score, we treat it. So there are different kind of medicines which we give to the patients according to the score. So there are we can usually we divide it into mild, moderate, and severe. In mild cases, we usually recommend some calcium and vitamin D supplements. If the disease is a bit severe, like if it's in the moderate category, then there are some specific drugs. And then the severe category, there are another different line of drugs like mostly injectables or nasal sprays, which we use for the treatment of this osteoporosis. There are a few things we can take care, like smoking is a big risk factor. So if you are doing smoking, and then you need to reconsider it and try to quit it. And similarly, tobacco chewing is also a risk factor. And few people take steroids for some diseases like some skin problems or medical problems. So if there is any alternative medicine you can take instead of steroids, then it's bit useful. Then if you are diabetic, then you need to control your diabetes so that your sugar levels remain normal. And if you have any other problem like thyroid is also a reason for osteoporosis, so you need to control it.